And that brings us to our 7 Up Front tonight. As the COVID numbers fall, counties and schools are dropping their mask mandates. Joining us live is Dr. Avani Sheth, Wayne County's Chief Medical and Health Officer. Dr. Sheth, thank you for being with us tonight.
Thank you for having me.
Well, we know Wayne County dropped its mask mandate for schools yesterday. So can you tell us what went into making that decision and how you ease fears for those who believe it might be too soon?
Absolutely. So there were several factors that we considered when we made the decision to lift the school masking order in Wayne County. So basically Wayne County, not including the city of Detroit. We are seeing important measures of how well we're controlling the spread of COVID-19, including cases and hospitalizations, and our vaccination rates all headed in the right direction. In Wayne County, we've seen a sharp decline in case rates. Our 7-day case rate it dropped 90% from its peak with the Omicron surge, and this is lower than the state rates. And this is putting us at levels we haven't seen since September. Our percent of tests that are coming back positive have also dropped significantly. We're at 9%, and this is a 26-point drop from its peak. Our COVID hospitalizations in our region, which is really an important measure of how much severe illness we're seeing, has dropped 65% from peak. And our hospital capacity, which is very important, especially in this last surge where we just saw so many large numbers of people getting affected, and we wanted to make sure that hospitals are able to operate safely, that also has stabilized. And in Wayne County, we're encouraged by our vaccination rates. Those that have received at least one dose, we're at 73%. 67% are fully vaccinated, and both of those rates are better than the state rates. So all of these numbers together, we're headed in the right direction. And more importantly, what we have now is a safe and effective vaccine for all those that are 5 and up. So all of these factors together supported the decision to lift the mask requirement. And I want to be clear that masking still continues to be recommended. We know they are a very effective tool, and it will be very important that we continue to support our children and families who want that extra layer of protection and who are at higher risk themselves, or their household risk is higher for severe illness, or based on their vaccination status.
You know, this really is news that we've been waiting for, kind of a sigh of relief to hear that we're going in the right direction. At the same time, we've been talking about the Omicron subvariant. They call it the stealth Omicron, with the potential to be more transmissible and even more severe. So what are you hearing about that, and how do you see the pandemic playing out as we head into the spring and summer?
So, we are at the point of the pandemic where there is more control, right? We've come down from this really significant surge, and we're coming down from it. But moving forward with whatever variant we see, we have the tools, we know the tools that we know to keep ourselves and those around us safe. And I think this is really important to keep the positive trends we're seeing going. Moving forward, we need to learn to live with COVID-19. And we know the protections that are important that will help us keep this trend going. So, first and foremost, what's going to be so important is getting vaccinated and boosted. It's the single best way to protect our children and all individuals from severe illness. So it's the difference between, getting a bad cold or ending up going into the emergency room or the hospital, and can reduce the risk of long-term symptoms from COVID-19. So all children 5 and up should get vaccinated. All 12 and up should get vaccinated and boosted. And I just want to lift up the importance for all your listeners of the booster that was extremely critical during this Omicron surge, where we did see many of those of us that were vaccinated get infected. But that extra booster dose was 90% effective at keeping people out of the hospital. So I cannot stress more the importance of now is the time. Do not delay your vaccination or your boosting. And then, masking. Masking continues to be an important tool. Mm-hmm. Masks and high quality masks are increasingly more accessible. Mm-hmm. Wayne County Health Department has distributed about 900,000 KN95s across Wayne County through our community partners. And that masking is going to be especially important for people to, keep doing, especially in the first 10 days after testing positive or with a recent exposure. And, you know, at the state level, they lifted their indoor masking advisory, but it's still going to be important to mask in those higher risk settings like healthcare settings, long-term care facilities, shelters, congregate settings, and whatnot.
Well, Dr. Schaff, certainly appreciate your words this afternoon and what we all need to adhere to, and just know that we're in the right direction and in order to keep us going that way. Thank you so much for being with us tonight.
Thank you for having me.
Okay.